Hey, so I wanted to call and give you a report on a patient we're sending over to the emergency department. This is Mr. Smith. He's a 58-year-old male. He presented today as a sick visit in the primary care setting. His chief complaint was that he's been having chest pain and dizziness. The onset of his symptoms began yesterday during the day and can continue to get worse. Location of the pain, it's pretty diffuse pain, but he says kind of the middle of his chest, and it's local and it's radiating up to his head. The durations of symptoms were yesterday, and then it's getting worse. He describes the characteristics as tight, dull, and he feels exhausted. And he felt like he had episodes where the room is spinning. Nothing seems to make it, worse. What makes it better is him just sitting down and resting. Um, he said whenever the chest pain was at its worst, it was an 8, and he rated the dizziness an 8 too whenever it was at its worst. His only past medical history is hypertension, and he had heart stents placed in 2020. Hyperlipidemia, type 2 diabetes, mellitus, obesity, and COPD, all which have been managed pretty fairly simple in the outpatient setting since his last stent in 2022. I did a review of systems on them. All were normal besides what I'm going to get into in a little bit more of the objective findings. Bradycardia was noted during palpation and auscultation of the heart. His objective findings, he did appear to be a bit lethargic. He was ANO times 4 and answering questions appropriately. There was no any outward signs of trauma or anything notable on extremities. Like I said, with his heart, I couldn't hear anything abnormal. It just sounded like sinus Brady. His cranial nerves were all intact, but his vital signs were his blood pressure of 99/54. That was the second time we took it. His heart rate was 37, 18 respirations, no fever, no fever. So the assessments we kind of did on him, we conducted an EKG, which showed sinus bradycardia. Secondary, I'm pretty concerned that it could be an electrolyte abnormality. I verified his medication that he's taking in the schedule. So it doesn't seem like there would be any kind of medication overdose. He seems to be pretty aware of his medication. But EKG we showed that I'll send over with you, it is sinus bradycardic. Due to him being symptomatic bradycardia, I want him to get over to the emergency room pretty stat. So we're going to go ahead and call 911. We did throw an IV in him and gave him some IV fluids because he felt like he was going to pass out. I think for the plan for him, for us going forward, is after his emergency department visit and likely hospitalization, I want to decrease any of his beta blockers. And kind of start there. And then we'll have him follow up with a cardiologist. I think it would be beneficial for him to see a cardiologist while he's there, get some stat blood work, get some stat imaging, and see what we have going forward. If there's any other questions about the patient, just give me a call back. Here's my number.